wants to turn off their camera or change their name to keep anonymous, go ahead and do that too.
And we're good. Go.
Awesome. Well, Steve and everyone else, thank you for having us tonight. We're very excited to participate. We represent From the Earth, a group of dispensaries around the Kansas City area. Our brand is also present in California. We've got a long history of participating in treatments for cancer patients, helping alleviate a lot of symptoms associated with the treatment. And we're very, very excited to be here. I know later on we'll revisit this, but before we get too far in, I want to also mention that for anyone who is a member of the Prostate Network, I talked to Steve about this. We'd love to make sure that you know that depending on what you learned today, and if there is an intrigue or appetite for you to try out anything that's available in our stores, we are going to offer a discount for anyone here. If you go in and you say that you're a friend of Caesar's, to pay tribute to Caesar Blevins, the co-founder of the group, we'll make sure that you get a discount on all your purchases.
Awesome. Thank you.
What is your dispensary's name?
The name of the dispensary is called From the Earth.
Oh, okay. Sorry.
No, it's a great one once you get it, but that first time there's a little hiccup because it sounds like it's a product from the earth, but that's where the name came from. And it's kind of right in line with what the product is, how it's kind of evolved, and why it's no longer the illicit product that it once was. And because of that transition, we wear a hat now for a brand, illicit, and rather than it being kind of an illicit example of it, we actually chose this brand to draw more attention to the fact that it came from somewhere that was viewed negatively, criminal activity and things like that, but it's come a long way now, where it's no longer illegal in certain states. Obviously there's a big federal hurdle, but the states where it is legal, it has seen a lot of adoption, especially by people who have medical cause to alleviate symptoms for with cannabis. And just to like throw out a couple other examples of things that evolved into mainstream medications based on plants, even aspirin. You know, I think Hippocrates 2,000 some years ago treated pain with willow bark, and the salicylates in the willow bark were translated into acetylsalic acid, which is aspirin. I think we see a lot of that, the quinine, the malaria drug, also based on plant extracts, and Taxol, the cancer drug, comes from the Pacific yew tree. So I think there's like a great foundation for this transition that's taking place right now, looking more towards natural ways to treat things that are associated with all sorts of challenges, but also specific to cancer treatment regimens. How was that for an answer?
That's good.
Where is the closest one to Tom? Tom's in like Casey Mo. Where's the closest store?
We've got 3 in downtown Kansas City. We've got one opening soon. We're going to open next Thursday or 2 Thursdays from now on June 17th on 12th and McGee, right downtown Kansas City. We have another one at 6200 block of Troost. And we have another location we call it West Side, right there. If you know where Shooty Lumber is, it's on 2918 Southwest Boulevard.
Perfect.
We also have 2 stores, one in Raytown and one in Independence, for people who are in those areas of the city.
Did we want Stephen to maybe explain a little bit about Elevate and how to sign up for cards, and then we can go into April? Or
I'll introduce myself whenever you want me to.
Jump in there.
yeah.
All right. Well, I'm Steven Stearman. I'm the co-founder of Elevate Holistics, and we're an online cannabis clinic if you will. So we have physicians that hang out at home and want to help patients get access to medical cannabis. So we have an online platform, so you book your appointment with us and we help you fill out your forms and get everything processed with the state. And then you'd be able to basically work with us first, and then you'd be able to go visit Sam and the team and Carolyn at From the Earth. So we work very closely with our organization to make sure that patients get certified in a safe and compliant way.
So that was a big mystery for me. I know I had no idea how that was supposed to even work. Like, so you've got to know Stephen or somehow get connected there before you can safely walk in the store. Is that how it works?
Yes, exactly. So Missouri is a medical market, so we don't have adult use in this state yet. So you have to get approved by a physician. Oftentimes the reason that companies like mine exist is because either one, you don't have a primary care physician where, I think a lot of people turning in here will have one. But what you see is hospitals and doctors that are under certain corporate umbrellas aren't able to certify patients for cannabis. And so you find a service like ours to be able to review some health information. It's really a quick process, especially with people that have, documented health concerns. And we give you the certification form and help you submit it all to the state. So for anyone coming through, the Prostate Network, we're doing a really big discount, as this is something that is pertinent. And we've seen time and time again, we've served over 15,000 patients between Missouri, Oklahoma, Arkansas, and a couple others. And we see a lot of people that have some sort of, it doesn't have to be terminal, doesn't, any sort of serious disease, but get serious relief from applying cannabis as a medicine to the regimen, whether that's tinctures on a small quantities, whatever that is, even something serious like Rick Sampson oil, which I'm sure, April will touch on, which is a pretty serious product. So we're extremely grateful for the community here in Missouri, and the medical market here has a lot of really good product to help patients.
That's awesome. Could you put like your link to get a hold of you in the chat maybe?
Yeah, absolutely. Yeah, I'll put that up with a coupon and some other stuff in the chat so people have access to it and can check us out. And again, we work super closely with From the Earth, and we know that they have top-notch products compared to a lot of people.
So awesome. I'm so glad you guys are here to share this with everyone tonight.
Good.
Well, Stephen touched on some pieces that are pretty relevant for us also, talking about quality of product. Consistently, the brands that we do carry at From the Earth, there's testing data for everything. Everything has to be tested before it comes out. That's available on every package that you buy. Reading that can help guide you on how to dose. And I'm sure April's going to talk about this a little bit more. But being aware of that piece is definitely a critical component. But also the variety of terpene profiles and things like that in all the products will affect how each thing, how each medical situation is addressed. But I also want to say a special message. Right now, we're actually waiting for the 90-day results from my father-in-law, who is a prostate cancer survivor. Extra special meaning to be here tonight. He underwent Proton Therapy earlier this year, and is doing great. But we're waiting on that official word that he's in remission.
Wow.
We'll
Well,
be thinking of you, Sam.
yeah. And Sam, now you got to get checked. Younger.
Yeah, absolutely.
Yeah. Well, that's yeah. Let us know when he gets the all clear, man.
I will. Thank you. I would love to. I can't wait to convey that message.
Yeah, that's a good one. We like those.
Yeah.
Wonder if I could ask what proton therapy is. I have not heard of that.
Good question, Phil. So proton is a different type of radiation therapy that has not been available in Kansas City, but there's actually a couple of new centers that are being built now that will offer it. It's just a different technology. There's some people that swear by it. It's really been popular and like with children, like in like brain cancers and stuff like that. It's more like precise, and so it hasn't been super widely used in the guys, but that's getting ready to change, and it's going to become more broadly used. Right now, you have to travel if you're in Kansas City to get it.
I was going to ask where you could get it at.
Gosh, it's like everywhere, but Kansas City, they're building like, I think there's 3 of them now. They're like crazy expensive, but we had none, and now all of a sudden we're going to go from 0 to 3. So it's still about a year away though.
Thank you.
Steve, the closest one is Washington University in St. Louis. And then where I went was Rochester Mayo Clinic.
Thank you,
Yeah.
George.
There is one in
Hey,
Oklahoma too.
Do they have one in Tulsa?
I know somebody went to Oklahoma somewhere.
Close by in Tulsa, yes.
Yeah.
I forgot, it's a private group, but I forgot the name of it.
Cancer Centers of
Yeah.
America.
Cancer Centers of America, okay, yeah.
Yeah.
Mine was the Mayo Clinic, and then there's the Barnes Hospitalization, which is Washington University in St. Louis.
George, could you characterize what the advantages of proton are over radiation?
Well, I'm no medical doctor, but
Understand.
the X-rays, as I understand it, were a little more broad in terms of what they encompassed with the radiation, whereas proton beam is a little more pinpointed, shall I say,
Mhm.
in terms of it. Basically, at Mayo Clinic, they had what was a pencil beam, and it's where the most effectual impact of the X-ray or proton beam, when it hits a target, it is totally there, and they can pinpoint that target better without some, say, peripheral X-rays.
Good to know it. Thank you.
So I believe if you're a radiation candidate, as I was, it's something to consider and look at.
I had my radiation. I'm done with that, but I'm always interested to know about other technique.
Yeah. Yep. Okay.
All right, you guys ready for me?
Please take it away. I can't wait.
All right. So I am going to share a couple slides. I'm going to be referring to some terminology you're probably unfamiliar with. So I think that it helps if you can look at something while I'm speaking. Steve is also going to get these slides out to everyone. Feel free. I'll probably run through it kind of fast. Feel free to, write down questions or ask questions at the end. I'm absolutely going to stay on and answer those for you. First, I do want to say thank you so much to Carolyn and Steve for inviting me to do this. My passion has always been teaching patients and providing education, so I appreciate the opportunity.
We're so glad to have you. Can you tell people a little bit about your background?
Yeah, so I'm actually got a slide on that.
Oh, okay.
So that way I don't tend to go off on too much, but every time I talk to patients, I always just have to tell patients that they always need to try and have an open, honest relationship with their doctor. I'm a registered nurse, been a registered nurse for 16 years. I've studied cannabis for the last 6. I know a lot about cannabis, but I am definitely, really just a source of education and information. If you do have questions about your particular treatment, definitely make sure you talk to your doctor about that. And that's just my disclaimer to protect my nursing license. All right, so I started off in the emergency room. I loved working there. But after a couple years, I realized that I wasn't actually really helping anyone. We were just sending patients out the door, stabilized enough to go home, or we were sending them out with prescriptions. That made me decide to go and get my master's degree in public health nursing, because I did know that I really wanted to teach people, promote health, and prevent disease. So that's really what I've done over the last 10 years. It was about 6 years ago, my son suffered a traumatic brain injury, and there were, all the physical therapy, speech therapy, several appointments a week. I was a nurse in Kansas City. I knew all the good neurologists, and I took him to all those doctors, and it was just prescription after prescription. He was just not getting any better. So finally, someone mentioned cannabis, and I honestly, working as a nurse for these big corporations, cannabis had always kind of been lumped into the same category as methamphetamine or heroin, but it was okay for people who had terminal conditions, severe pain, cancer. It was okay for them to use. No one really taught us how cannabis can be used just to promote overall wellness, deal with anxiety, depression, and all these other conditions. When my son, when I did have to be home with him full time, I did pick up a couple private duty patients. So people who were most often on hospice, or their Parkinson's was pretty severe. And I saw what some of the cannabinoids that were available at the time. So like THC and CBD, I'm pretty sure we're all familiar with those. CBD has been available for a while. I was able to see what that did for a lot of my patients I cared for. And so it just kind of snowballed from there. I just started helping more people. My grandmother was one of my first patients. She'd been prescribed opiates for about 12 years. And because of a prescription drug monitoring program, she was basically kicked off her prescriptions and really suffered and went through withdrawal. So I was able to, provide her with some relief. When cannabis was voted, the medical law was passed in 2018. We decided to make a legitimate business of this. I had been spending a lot of time in Starbucks, the library, or on the phone helping patients. But with it being finally legal, and the Missouri State Board of Nursing saying it's okay for me to talk about cannabis, is when we launched this organization. And Cannabis Care Team, really our goal is to prevent anyone from going through kind of what I went through when I was trying to determine what was going to be best for my son. And it was just really overwhelming, and I had been in dispensaries and in states where they have like adult use, so you can be 21 or over. It was just extremely overwhelming for me. And so we really want to prevent that for patients here in Missouri. And we actually have patients all over the country now. I think we're up to maybe over 1,000 patients that we've been able to help. So we're really, really proud of that. The support, the education, and the advocacy is what we really strive to provide to patients, one-on-one, and then of course with educational events like this. I was asked to teach cannabis pharmacology at an accredited university, St. Louis University, which was pretty exciting. It's really good to know that these universities are starting to talk about this because people are asking about it. And there's not a lot of people out there who can answer them, especially doctors. All right, so, there's a couple things that I really want you to take home tonight, and I really want you to all know system in our body, and it's called the endocannabinoid system. Some of you may not have heard of it, but it's a system in our body that's just like, we have the neurological system, the cardiovascular system, the integumentary system. They all have their role and their purpose. And the endocannabinoid system was discovered when we were studying cannabis starting in the 60s. And so this system, it's really responsible for maintaining balance or homeostasis in our body. So it connects to all of the systems. As you can see, it's got a couple different components. There's 2 that I'll talk to you about. But overall, this system, when it's healthy, it is responsible for how we relax, eat, sleep, forget, and protect. And those are all very important to overall wellness in general. Now, the two pieces of the endocannabinoid system that I want to talk about are the receptors. We have these endocannabinoid receptors, and then we have endocannabinoids.
Can
So,
you go back? What
yeah.
are they, like our part of our nerves? Are they're connected to our brain? How's this? This is a new term for me.
Yeah, it's actually at a cellular level. So it's there's neurons, molecules, enzymes. It's it's not like a lot of the other systems because it happens on such a small scale, if that makes sense.
Huh. Fascinating.
Yeah. So there are some really good resources out there online. Projectcbd.org is an excellent resource where they talk about the endocannabinoid system. So definitely go to that website and check that out.
Well, we've heard people complain about the relax, not being able to relax, eating, sleeping, all that stuff. Those are common issues with prostate cancer.
Yeah, absolutely.
And so if this is the system that has that role.
Absolutely. I think with most of the cancer patients that I've worked with, the one commonality they all have is that anxiety and depression. So the endocannabinoid system works with some serotonin receptors. It really does a lot at the cellular level to promote mental health. And we'll talk about how people can do that without consuming cannabis as well. So the two areas of the endocannabinoid system I want to talk about are these receptors. So these receptors were discovered again when we were studying cannabis, and there's hundreds of articles about this system. It's not something that a bunch of cannabis doctors made up. It's very proven in science. So these CB1 receptors, those are the ones that typically interact with THC. And you can probably see from the slide that those CB1 receptors are found more frequently in the brain. So we all probably know that for patients who have poor appetite, weight loss, pain, those are all the things that are controlled in the brain. We know that THC helps to promote, appetite, reduce pain. So that's really what those CB1 receptors are doing, is they're interacting with the THC. And then also those CB1 receptors, as you can see there, it says short-term memory. People often do experience a little short-term memory loss if they overconsume or consume cannabis. Now these CB2 receptors, and some of you may have tried CBD or someone who's tried CBD, but the CBD is typically what interacts with these. I really don't think this picture does it justice, but the CB2 receptors are actually all over the body. For a long time, even after we found success with cannabis for my son and some other people, I just kept hearing so many people say that CBD did something for them. It seemed like a cure-all for everything, and I just didn't quite believe it. But once I started to study the cannabinoid receptors and how CBD interacts with those receptors, I saw that there is absolutely a lot of potential for CBD to improve so many conditions. If you just look at the fact that the CB2 receptors are, most often found in the immune system. What's our immune system responsible for? Our immune system is responsible for inflammation. So when our bodies need to fight an infection or something, our immune system reacts. When we're done fighting that infection, our immune system, knows what to do. And the endocannabinoid system plays a part in telling the immune system what to do and when. So for a lot of these conditions, people are taking CBD for arthritis, Lots of, there's some patients who are taking it to manage their diabetes. It's all about that inflammation and decreasing that inflammation. I think probably 70 to 80% of all conditions are related to inflammation at some level. So if patients want to try CBD with THC, I mean, there's going to be definite benefits of both of those. It really depends on what the patient is looking to achieve.
Arthritis, you said.
Absolutely.
Rheumatoid arthritis.
So rheumatoid arthritis is an autoimmune condition, and that is really when your immune system is attacking its own tissues. So we need the endocannabinoid system to work to tell the immune system to stop attacking our own bodies.
My mom had it. I was told I'm gonna start to get it at some point. So good.
Well, let me know, and I've got some good resources as I'm sure From the Earth does as well.
Good.
So I do talk to a lot of patients all over who unfortunately aren't in states that your medical cannabis is legal. Some of you may be in Kansas. So I always want to make sure that they understand that they can promote the health of their endocannabinoid system with some of these things. So we all know, I'm guilty of it just like everyone else. We tend to consume more levels of bad fats, right? I probably don't eat enough nuts. I probably eat more animal fat than I should. I mean, we all do. But when we balance that fat with when we balance the omega-3 and the omega-6 fatty acids, we see the health of our endocannabinoid system improve. And this has, been proven by science. We all know that eating those green leafy vegetables and those fruits and vegetables that are really bright in color, those not only provide so many benefits, but they also improve the health of the endocannabinoid system. Who's ever experienced the runner's high after a good workout?
Yeah.
So we always thought that was actually that was caused by the release of endorphins and hormones. That's what we thought until probably 15 years ago, and they discovered that it's actually the release of the endocannabinoids that our bodies make. So that runner's high, that like blissful feeling we feel after a good workout, is the endocannabinoid system. It's all these endocannabinoids flowing through our blood and we're feeling them. And there's some good articles on that as well. Stress management is really important for, as we all know, just for everything, just for overall mood and health and wellness. But, for people who, according to the science, for people who are able to manage their stress, maybe they're, taking frequent time for themselves, all those self-care things that we all need to do more of, those people actually had a healthier endocannabinoid system. So they had more endocannabinoid receptors and were producing more endocannabinoids. Play. I know we all need, lots of exercise, right? But we want to make sure that anytime we're kind of playing or exercising, that it's something we enjoy. There's such a thing as bad stress. If you are finding that going to the gym and working out for a long time isn't something you enjoy, it's probably not going to improve the health of your endocannabinoid system. The other thing that I will add is there was a study that was recently published, and I hope it's okay that I talk about sex on this call, but they actually found that after people achieved orgasm, that their levels of this endocannabinoid our bodies produce called 2-AG was much higher. So we know that a healthy amount of sexual wellness is an important part of overall wellness, right? All right, and so now I want to talk about kind of like whole plant medicine and why people see so many different benefits, again, from cannabis. There's this term called the entourage effect. And the entourage effect is when you take all of the beneficial compounds found in the cannabis plant and they work together to provide the most benefit. So there are, products out there that you can purchase that may just have CBD. That would be called a CBD isolate. When that product just has CBD, it's not going to provide the overall benefits like a product that would have maybe CBD and just a small percentage of THC to make it to where it can be legally sold all over the United States. But there's not only THC and CBD, there's all these other cannabinoids that we've learned a lot about. And I'll talk a little bit about those on one of these other slides. But the other compound that, we haven't told enough patients about, unfortunately, are these things called terpenes. So terpenes are like the essential oils of plants. We've all smelled lavender or used lavender or, put citrus oil in something, right? The cannabis plant has all of those as well. So terpenes are just something that the plant produces to help it reproduce or to protect itself. And of course, cannabis is a plant, so it's going to have those as well. And then flavonoids, you've probably done some research of, about the health benefits of blueberries or bananas or, a glass of red wine occasionally. And that's really because of the flavonoids, which are also found in cannabis.
So April, can I ask a quick question? I did
Absolutely.
some research specific to what you're talking about as it relates to specifically prostate cancer for today, and I found a couple articles that showed research showing that specifically prostate cancer cells have an increased prevalence of cannabinoid 1 and 2 receptors, and that when stimulated, it actually more rapidly affected apoptosis or like the life cycle of those cells. So it was causing those cells to die faster. Is that something that you've seen as well? Is there more research on that than what I found with my cursory research?
Was that a study in mice or rats, or was it in humans?
No, this was humans. This was,
Okay.
I'm looking at it right now, the 2012 study. I'll send the link.
Yeah, send me the link. Absolutely. Yeah. When it comes to, cannabis and different types of cancer, I think that in the future, we'll be able to know what exact product we need to purchase from the earth to treat a particular type of cancer. As we all know, cancer is really individualized. Even, breast cancer, there's different types of breast cancer, right? Hopefully at some point we'll be able to really fine tune what cannabinoids, what terpenes, what types of cannabis will be able to provide the most benefit for a particular type of cancer. I don't know that we don't know that yet. I think most people kind of go at it with, we're just going to do everything that we can, and oftentimes that means consuming whatever they can get. But yeah, definitely send that to me, Sam.
Yeah, I will.
Yeah, and if send it my way too, we've got a page and we're starting to collect stories on this. And
that's great. Yeah, I found two. I'll send both the links that show an increased positive result for specifically prostate cancer cells when you're stimulating that cannabinoid receptors 1 and 2.
Fascinating.
That is. So CBD, I've talked a little bit about that. Oftentimes patients call me and they say they tried CBD and it didn't work. Patients don't when they purchase the CBD, maybe they purchased it from a place that didn't provide a lot of education, but CBD does not, doesn't work overnight. It's got to get in, and it's got to really work with the endocannabinoid system before people can see improvements. So for a lot of my patients, they're taking CBD 3 times a day. The dose is different for everybody. They all, pretty much start off at the same dose, about 10 milligrams 3 times a day. And they slowly kind of increase that from there. But it's when people add that CBD to the THC, that it really makes a big difference for people. CBG is one that you'll probably see if you go to a CBD store, but it is now available in tincture form. But it is known as the mother of all cannabinoids. It's this cannabinoid, a compound that comes from the cannabis plant. It is actually kind of what we find in the cannabis plant before it turns into everything else, like THC, CBD, and all that. It is one of my favorite cannabinoids to talk to patients about because it's not psychoactive, it's non-intoxicating, it doesn't make people feel high, but it does provide some almost immediate relief. So for a lot of patients I have that have issues, gastrointestinal issues, IBS, maybe they have, chronic pain, muscle spasms. CBG is something that they can take and they can feel it working, but it's not psychoactive. A lot of patients I work with aren't consuming cannabis to really get high. They're just consuming it because they want to heal. CBN is a pretty popular one now. It's what we find in the later stages of cannabis. Sometimes, and I'm sure From the Earth isn't doing this, but sometimes dispensaries you'll find it that cannabis has been discounted because it's not as fresh, but it actually has a really good cannabinoid in it that could help people with sleep. There's a lot of research that shows that CBN could be equal to some anti-seizure medications. And I know a lot of people are like this, but when you can get something from a plant, people are trying to do that versus getting a prescription that may have a bunch of side effects and may, they may have to take another medication just to counteract those side effects. So plant medicine, whole plant medicine is, really what we teach patients about. All right, so I talked a little bit about terpenes. I'm just going to do a time check. So like I said, the essential oils of cannabis, just like the essential oils of all plants, we've been able to study terpenes a little bit longer in the United States than we have been able to study cannabis, just because cannabis has been federally illegal. A lot of the research on cannabis comes from other countries, but these are just 4 of the terpenes that we find in the cannabis plant. So Sam mentioned, the different terpene profiles that you find in cannabis. So there are some strains that are going to be higher in linalool, and that's going to be, a product that is going to provide more relaxing effects. There's going to be some cannabis, you smell it and it smells like a pine tree. It smells like you're in a pine forest. We know from research that pinene in that cannabis is actually, can provide actual medical effects. Some of those effects are there. Beta carotene is probably my favorite because it does interact directly with the CB2 receptors in our body, and it's anti-inflammatory. I know a lot of patients report that when they consume something high in beta carotene, they do get a little bit more pain relief. And we're going to see some research come out that shows that beta carotene is actually being used with THC and CBD to treat some drug addictions. Myrcene, that one on the bottom there, is just probably the most common one in cannabis. It's really good at helping people relax and helping people sleep. Are we still doing good, everyone?
Yeah. keep going. This is
Question
fun.
for you, April. You're uniquely qualified, I think, to answer this question. I do some forensic work for people who are in car accidents, and sometimes they take their blood and test them for cannabinoids. Would these kinds of things that you're talking about show up in a drug screen for I can never say that.
That's okay.
For
Yeah, so the CBD, no, would not in what they're looking for, you know, during a roadside test. The CBG, no, but if that CBG is in a product that has a little bit of THC in it, you know, absolutely it could. When they grow these plants, there's going to be all sorts of cannabinoids in there. It might, you know, primarily be CBG, but there's going to be a little bit of THC in there most likely. So that THC, that metabolite that they're testing for, could absolutely show up. And because we just don't have any good roadside tests, you know, someone can consume cannabis and it can still be in their system, you know, 30 days later from a blood test. So I think that there's a couple organizations in Missouri that are doing a lot of education with law enforcement on how to determine impairment during roadside tests. And then whoever comes out with the breathalyzer or whatever test they can use to see if someone's intoxicated, they're probably going to be set for life, because I know that that's something that you know, law enforcement really needs to determine impairment.
absolutely. Thank you very much.
Yeah, absolutely. All right, so when you walk into From the Earth, there's going to be a menu, I'm sure, but there's going to be some options and some choices that you have. What I do with patients really before they get into the dispensary is we talk about, you know, have they thought about how they would like to consume cannabis? And we talk about the pros and cons of the different ways to use it. So I work with a lot of older women who have arthritis, and really the first one that they're going to try is going to be like a topical salve, lotion, or oil. You know, they want to put that directly on the spot that's having pain, and that can provide some relief. However, it's not going to reach the bloodstream, so it's not going to really improve the condition of the endocannabinoid system. There are certain patches and transdermal gels that have been specially formulated to reach the bloodstream. So there's, you know, THC patches. I mentioned CBN is kind of the, it's kind of like the sleepy, relaxing cannabinoid. There's all sorts of patches that will be available soon in Missouri, but you know what patients can do with those is they can take the patch, they can cut it in half, they can cut it in quarters, and they just need to make sure they put it on a part of their body that where there's a lot of blood vessels. So the top of the foot and the inside of the wrist seem to be the most popular places. So again, if it's going into the bloodstream, it's going to reach the endocannabinoid system, and that's overall going to provide more benefits. There's edibles, gummies, chocolate, drinks out there, and a lot of patients do prefer to use those because they are really discreet, and a lot of people just don't want to smoke anything. You know, it's just important that everybody knows how much is in a gummy, how much is in 5 milliliters of a drink. With everything related to cannabis, we want to start at almost sub-therapeutic or very low doses and kind of work our way up from there. So we can find a dose that doesn't cause any side effects, but that provides the effects the patient is looking for. There's capsules available. Some are made with they put the dried flower in the capsule, and some are made with a cannabis oil that they put in the capsule. You know, patients love those, especially patients who already have a pill box. The dried flower capsules, if you do purchase those, just know that you will need to consume something with a little bit of fat. Because THC and CBD both love fat, that is going to increase the metabolism and absorption of that THC. So it'll be more effective. Tinctures and oils, man, if you could see my office right now, tinctures and oils are definitely my favorite. I think, you know, they're just very convenient for people. Oftentimes, they can kind of fine tune their dose, whether it's THC or CBD or any of these other cannabinoids. Patients really do like tinctures. And there's some tips and tricks I will share just to help promote the absorption or the what we say bioavailability of the tincture or oil. So for patients who are getting ready to use an oil, I always say if you can, just get a toothbrush, you know, brush your teeth, brush the inside of your cheeks, your gums, your tongue. Really, you want to increase that blood flow to the mouth. Now the tincture, you know, it'll have a dropper. And so you'll take that, you know, whatever amount that you want and you'll place it under your tongue. You know, patients try to hold it under their tongue as long as they can, but if they can't, they can kind of swish it around in their mouth. It's going to be absorbed, and you know, there's your whole mouth is like a big giant blood vessel, honestly. So they just want to try and keep it in there for maybe a minute before they swallow. When patients use a tincture or oil, they usually start to feel the effects, maybe 15 minutes. But then from the stuff that they swallow and goes down to the gut, it could take about an hour.
I had not heard that. I just swallowed it. I had no idea. I totally wasted it.
You have no, I know, and most people don't, and that's
I didn't
why,
know.
yeah. So, and with edibles and drinks, I didn't mention this. The kind of the standard, as we say, it takes about an hour for an edible to start working. There's lots of edibles out there. They're formulated differently these days, so they can actually, you know, you can feel effects in as little as 15 minutes. People just probably want to wait an hour before they were to consume any other cannabis to give it time to really take effect. Smoking, you know, we have been, there's been a lot of propaganda out there, and we've been, you know, told, you know, that smoking cannabis can cause certain things. Really only smoking cannabis, what it'll do is it'll cause chronic bronchitis for people who smoke a lot. From the research, there's not an increased risk in patients who have lung cancer. Any one of those studies was actually, there were patients who were smoking cigarettes and cannabis. So it's not as dangerous as we were all taught. It does smell, you know, and there is smoke. So some people want to avoid that, so they choose not to do that. There's vape cartridges, there's vape devices, there's all sorts of things, and I'll talk about one of those methods in just a minute. But for a lot of people, you know, they want to maybe target a specific area. So for a lot of women who have lower pelvic issues, for people who have gastrointestinal disease, they really want to target that area. So those people actually prefer a suppository. You can get CBD suppositories, THC suppositories, not yet in Missouri, but those have shown, you know, to provide, you know, anti-inflammatory benefits, help with pain, etc. Suppositories, the bioavailability isn't as high as we always thought. So only about 10% actually makes it into the blood for our system to be able to use. But, you know, suppositories are sometimes only an option for patients who, you know, I've taken care of some very sick cancer patients who just couldn't open their mouth, couldn't take anything by mouth. Their families chose to use a suppository, and then kiddos with severe neurological conditions, their parents will prefer suppositories as well. So concentrates are kind of like this big umbrella for all of these new fancy cannabis products. There's hash, wax, shatter. There's so many different things, but they're just highly concentrated cannabis products. And the ones I want to talk about, and Stephen alluded to this, are the RSO or the FICO. So if you've done any type of Googling on cannabis for cancer treatment, you'll probably see those acronyms somewhere. So Rick Simpson oil. Rick Simpson was a gentleman who created this concentrated version of cannabis, and saw what it did for his skin cancer. And so, and I apologize, there's dogs and children. So he actually came up with this program that people can do, where they're consuming, just very tiny amounts of this highly concentrated cannabis oil throughout the day. And then the FICO is the same thing. It's full extract cannabis oil. So I'll have to run and go get one while you guys are asking questions, but it's just it comes in a very small syringe. Usually it's 1 milliliter, and there's about anywhere from 600 to 1,000 milligrams of THC in there. So if you think about there's 10 milligrams in a gummy you get in Missouri, you think about a very small syringe that has 1,000 milligrams of THC is going to be pretty strong. So when people come to me and they've done a lot of research and they want to try and treat their cancer with RSO or FICO, I'm absolutely supportive of patients making their own informed choices. But I just always want to let them know that when you're consuming that much cannabis, it's going to have some side effects. And oftentimes when people are trying to just manage a cancer diagnosis, it can be very, very hard. If you think about all of the appointments you've had, all of the different treatments, all of the insurance, phone calls and things like that, that's really, really difficult to do if someone is very, very high all day long. They're very forgetful. They want to sleep all day. But maybe that's what the body needs to heal. So with those patients or with you, always make sure that there's a good support team and kind of everybody knows what's going on, because that patient is just going to be pretty overwhelmed with the side effects of that. So dry herb vaporization, there's an image of what we call a dry herb vaporizer, that they've been using those in clinics since the 70s. It's a way to heat the cannabis to a certain temperature, so they're not lighting it on fire. So it creates a vapor, not a smoke. Dry herb vaporization for people who want to inhale cannabis. I always, talk to them about this option. Anytime that we're lighting a lighter right in front of our mouth, there's byproducts from that butane that people are inhaling. This heating it in this dry herb vaporizer prevents people from kind of breathing that in all the time. Also, we've talked about all these cannabinoids and terpenes that provide a lot of benefits. Unfortunately, when we light our medicine on fire with a lighter, we're burning up some of those beneficial components of the cannabis plant. So setting it at a certain temperature, THC, that temperature is going to be different than if someone is trying to get the effects from, maybe one of the terpenes. It's just heating it to the right temperature. It's not destroying all that medicine. This one in the picture, I don't know, that one can probably be purchased still today, maybe somewhere for $35. There are devices out there that cost upwards of $750. A lot of times they are using those in clinics and for several different patients, but it's just an option. It's an alternative to smoking.
Yeah, and could I interject real quick,
Yeah.
April? I know time is a factor too. Steve, are we stopping at 7:30?
I think, yeah, we usually go for about an hour. So yeah, we need to start to reach.
Okay, well, I was just gonna say, yeah, that process is called decarboxylation, and that renders some of the active elements in cannabis relevant to be able to be processed by the body. So when you have an edible, that process has already taken place. When you have the raw flower, it hasn't been heated, that it's not ready to be broken down and consumed in the same way. So when you burn it or ignite it or put it in a vape mechanism, that does break it down in a way that your body can consume and benefit from those pieces. And it occurs at about 220 degrees or a little bit higher. So a flame definitely does that, but so do these devices.
Thank you, Sam. All right, so this is my last slide. So this is just information that I've gotten from a lot of cannabis doctors I've worked with and a lot of research. So I didn't come up with these numbers myself, but you know, for people who are beginners and who are brand new to cannabis, I mentioned before that maybe starting at like a sub-therapeutic or very low dose is going to be the best option. So 2.5 milligrams to 5 milligrams of THC is, you know, typically a good place to start. When it comes to inhalation, that's usually just going to be 1 to 2 inhalations for beginners. They sell these things called pre-rolls or like joints in the dispensary. A patient would never want to start by smoking that whole thing. Just 1 or 2 inhalations is a good place to start, like I said. If patients are considering adding CBD, you know, I take it really more like a multivitamin because I know of all of the health benefits, but that consistency is really key, and patients do have to give it some time before they will start to notice the effects. For patients who are dealing with, you know, maybe pain, anxiety, some other conditions, sometimes they have to find both like a short acting method of delivery and a longer acting method of delivery. So inhalation would be a short because it, you know, kind of takes effect immediately and will last for a couple hours. Like an edible or tincture takes a little bit longer to start working and it lasts longer. So it's much easier to control pain and anxiety. And when someone has something kind of on board all the time, you probably all know this with different medications. You know, you often just have to take a lower dose if you're kind of taking it around the clock. And that's what we really call microdosing. So just very small doses. You know, we don't have to consume large doses of cannabis to really get the medical benefits of it. And that's it. So yeah, I apologize. That took me a little long.
No, this was fascinating. This was April. I commend you for what you're doing. This is remarkable work. I'm so glad that you were able to join us, and Sam and everybody, Caroline, for helping putting this together. This was you know, this is a great group of guys, and all we're trying to do is just help each other, and knowledge is empowering, you know, and now we got all sorts of new knowledge. So, and most of our conversations happen outside of our Zoom. So watch out. We'll be talking.
I have 2 questions for April, if I can.
Yeah.
Please jump in.
First question is, I'm on Lupron for another 9 months, and it causes me some kind of pain. Certainly, hot flashes, and wake up at night in the middle of the night with nerve pain in my lower legs and my hands. Anybody else have that? Show of hands. Anybody? Yeah. Okay. Thank you. So, what's the compatibility between Lupron and any kind of CBD, THC?
Well, there's several like potential drug interactions. So the liver enzymes that metabolize CBD and THC also metabolize about 60 to 80% of all medications. So what it kind of does to some medications is it increases the effectiveness of a medication or decreases the effectiveness of a medication. A medication like Lupron, you probably are going to want to be careful and make sure that you're maintaining an even balance of that. So, you know, talk to your doctor, but for some patients, they may take like a medication and then wait 2 hours before they consume any CBD or THC. Do you have to get your blood checked? Did they ever test your
The Lupron is like every 3-month shot.
Yeah.
Okay.
Yeah.
Okay. So I think that, I mean, I'd be happy to look more into that specific medication for you. And then just a tip for everybody. You know, if you're trying to figure out if there's any like medication interactions with things, if you go to just, I don't know, drugs.com, there's a drug interaction checker. if you put in a medication that you're on and then you were to put in the pharmaceutical cannabis medicines, and I would love to go over all of this with you tonight, but Marinol is the pharmaceutical THC, and Epidiolex is the pharmaceutical CBD. So you put in those two medications and it'll tell you if there's a risk for a drug interaction. There's a lot of potentials out there. There's really just a couple that we're really concerned about when it comes to, taking cannabis with it.
Phil, what I was told when I was at the Prostate Cancer Research Institute out in California, where it's been legal for years, the doctors were more prone to talk about it. They've kind of been around it longer than here. Was there's definitely benefits around the side effects. They said it's not going to really cure your cancer. Don't get wrapped around that. But there's so many benefits. If you're not afraid to try it, there's just a lot of upside to that. And I think it's going to be hard for us to get those answers, but I did not sense from them, and I can work on your computer. I can't fix your cancer, but what I sensed from them was there's just no downside to trying to defeat some of the side effects of the cancer treatments and what we've got to deal with.
Yeah, that's a good point.
Yeah.
Downsides are hard to come by if you're getting rid of a problem.
Yeah. Hey, I'm going to stop the recording right now, and then we can continue on here for a few minutes. I'm just going to hit stop, okay?
Great.
Was there another question? Oh, go ahead.
Is my doctor going to is he likely to recognize the idea that there